An advanced case of cancer of throat. The patient was a 74 years old gentleman who came for consultation on 3rd June 2003. The past history of the case. He had been suffering from cancer in right prima fossa since 2001. Radiation and chemotherapy had been done. Had also been given steroids. History of fungus on feet and buttocks. Chronic severe constipation. Bleeding piles. He had been a chain smoker and habit of drinking. He had been fixed laryngeal tube for breathing. So the patient was unable to utter a word. He related his story in writing. Apart from allopathic treatment, he has taken much homeopathic treatment with no appreciable improvement. Present symptoms as on 3rd June 2003 were as follows. Cancer of the larynx, mostly painless. Feels occasional stitching pain in ears, especially right. Slight tenderness under right ear and the lower jaw. Whole of the external throat indurated, inflamed and stony hard. Thumbnails excoriated. Dryness of the skin of legs with varicose veins. Loss of weight and progressive emaciation. Aversion to fruits and vegetables. Dryness of mouth, salivation diminished. Loss of appetite, taking liquid diet only. Thirst is normal. Constipation, stool once in 2 to 3 days. The condition of his throat is shown in the ensuing clip. This first video clip was taken on 3rd July 2003, that is 1 month after commencing the homeopathic treatment. The following second video clip was taken on 18 July 2003, that is after a fortnight of the first video clip. This third video clip was taken on 8th August 2003, that is about 5 weeks after the second video clip was taken. After 13th August 2003, the patient suffered from fever ranging between 99 degrees and 102 degrees Fahrenheit, along with distressing pain in right flank and spine at D10 and D11 vertebrae, later diagnosed as Cox lesion. These weakened him very much. The following video clip was taken on 17th October 2003. That is about 3.5 months after the first clip was taken. थोड़ी गर्दन जरा और ऊपर उठा पाएंगे? हाँ, ठीक है। अब बहुत डिफरेंस है। स्वेलिंग जो है वो बहुत कम हुई है। Medicines given were as follows. In the beginning, Raspeninator 200 once in 2 days. It is one of the remedies which antidotes the bad effects of radiation. And Magnesia Carb 30 intercurrently for 2 weeks was given. Then from 19th June 2003 to 13th February 2004, Barita Carb 200 once in 2 days. And from 14th February 2004 to 11th May 2004, Barita Carb 1M was given. Lastly, Phytolacca 30 once daily was given. Apart from the above remedies, a dose of Medorinum 1M, a dose of Tuberculinum 200, a dose of Mercurius solubilis 1M were given at different occasions as symptoms demanded. The case proceeded under homeopathic treatment as follows. After initial slight aggravation, the induration and the inflammation around his throat started reducing gradually. But there were few episodes of fever during 1 year ranging between 99 degrees and 102 degrees Fahrenheit, which were prostrating. During August 2003, his ESR rose to 105 mmR. He suffered from dehydration, as such was hospitalized. During September 2003, developed severe pain at one spot in his back at D10 and D11 vertebrae. X-ray revealed it to be Cox lesion, so he was given anti-tuberculous treatment. By 30th September 2003, his ESR came down to 61 mmR. Due to frequent episodes of severe sufferings, he had become too weak and emaciated. Findings of MRI on 25th November 2003 are suggestive of bilateral periventricular lacunar cerebral infarct and mild to moderate cerebral atrophy, having a non-specific lesion. During January 2004, felt dysphagia. As such, the feeding was done through tube fixed directly in the stomach. During February 2004, passed copious greenish fluid through the tracheal tube, which continued till March. After that, he felt generally better. As the patient was on liquid diet being fed through tube. Moreover, he was suffered setbacks due to severe complaints. Weakness and emaciation increased progressively, and ultimately he breathed his last on 11 June 2004. The comments for the case. This was a case of cancer already advanced too far, and when the patient came for homeopathic treatment, all necessary treatments, including surgery, radiotherapy, and chemotherapy, had been carried out. Though the patient did not survive, yet the inflammation and the induration were totally subsided. The end of the case, cancer of throat.